Sharif, are you online? Are you guys on the YouTube by any chance?
I mean, I'm monitoring it. I don't see anything.
No, I see it. I see it. It says live. I see it. Allah COVID-19 Townhall. I see it.
All right.
You have to go back out and refresh the page and go back in.
Can we tell who's on, in terms of people?
I have no visibility right now into that.
I mean, we can hear everything that you're saying as well.
On live stream?
Correct.
Alright, so we seem to be having some technical issue because I'm not seeing the stream. Alright, so it looks like YouTube is up and running. For some, they can see it. For some, we're not able to see exactly who's.
It shows 7 people watching.
All right. So
I mean,
we'll just give it another minute.
So I can confirm that we can hear and see what's on your screen. So.
Okay. All right. So on YouTube, there is going to be a slight delay. It's about, I think it's like 30 seconds behind.
Correct.
All right. So just quickly, for those who are on the live stream, welcome everyone. We're going to begin just shortly. We're just going to give another minute or two for people to join. As well, we're just having some minor technical issues. We're just working through with the live stream. Hopefully, we'll get that resolved as well. So while we're waiting for folks, we should hopefully get this all set up. So I just want to quickly just do a quick roll call for who I see on the call. So the way we did this, for those who are online watching us or listening on YouTube, is that our speakers for today, we're all on a conference call, and then the rest, again, to accommodate, there were some concerns about the limit that we had of who could attend. We adjusted to basically broadcast the entire meeting to everyone through our normal YouTube live stream. So with that, we have no limit on who can participate, and the process will be the same. In a minute, I'll share a slide. If you would like to submit a question or a comment or share a concern, you can send that through Menti. So very quickly, I just want to do a quick roll call for who is on the call. Maulana, Sayyid Muhammad Rizvi, are you on the phone?
Yes, I'm on the phone. Yeah.
Assalamu alaikum. Thank you so much for joining us. Mike Schlossberg.
Hi, everybody.
Hey, Mike.
Hi.
Salim Mauji.
Yep. Hey, everyone. Assalamu alaikum.
Alaikum salam. Asim Lilani.
Assalamu alaikum, everyone.
Ali Walji.
Assalamu alaikum.
Shane Hasham.
Assalamu alaikum.
And from the MAID committee, we have Ahmad Sumar that has joined us as well.
Assalamu alaikum, everyone.
Assalamu alaikum.
All right. So, Asim, what are we looking at in terms of who's on YouTube at this point? Can you tell?
Yes, we have about 19 people watching.
19 people. So, we'll open. Bismillah will open the session. Salim, if you can do us the honor with an opening surah.
Assalamu alaikum. Sure. Bismillahirrahmanirrahim. Can everyone hear me?
Yes. Yes, yes.
Bismillahirrahmanirrahim. Alhamdulillah, Alamin, Rahman, Rahim, Maliki, Yawmiddin, Yaqim, Budu, Yaqna, Sin, Sa'ata, Zina, Nabtalain, Fail, Mazubi, Lehin, Allah, Muhammad, Muhammad, Muhammad.
اللهم صل على محمد وآل محمد.
All right. So again, welcome everyone to this very important discussion. Again, the idea behind this was, I know right now we're all kind of isolated in our homes. There's not much, live interaction between us with the mosque being closed, and I know there's a lot going on overall. There's things obviously affecting our personal lives in terms of our careers, school. It's just beyond going to the mosque, and as well things that are going on outside our homes within the overall environment. Continuing rise in number who are getting sick from the virus. Things going on at the state level, which is why we have Mike Schlossberg on the phone here to kind of help help us navigate through some of what's going on and what may be to come. A lot of questions from a spiritual level. There's been some discussion obviously on burial procedures for individuals in our community who, God forbid, get infected with this, and some other very interesting questions that came up. And hopefully Said Rizvi can help us understand some of those matters. And as well, in a few minutes, Dr. Muhammad Hashim, who is an infectious disease specialist, will be joining as well. He's not on the call yet. I believe he said he'd join around 6:30. Also we'll have some questions. I know a lot of questions have already come through Menti, and a lot of them are related to the virus itself. So hopefully we can get that done. And I know there are a lot of questions regarding our ongoing operations, what's going to happen, how long is the mosque still going to be closed, and we're going to hopefully kind of share the current status as well as what the process is to make that determination when that time comes. So with that, I know Sayyid Rizvi had very some limited time. Sayyid Muhammad Rizvi had a very it was a very thorough presentation this past week, earlier in the week, and covered many topics related to procedures around burial, and as well handling of the body. And then there were some obviously questions in terms of some spiritual guidelines and things like that, or guidance that were asked. So hopefully most of you got to view that. We were hoping we get some new questions, but one very interesting question, and Muhammad, if you can obviously open and provide any information. Actually, let's just start there. So any opening remarks, Sayyid Muhammad, and then I can share one of the two key questions that we got that I don't believe were addressed earlier in the week.
Bismillah ar-Rahman ar-Rahim. Alhamdulillah Rabbil Alameen wa salatu wa salamu ala Muhammadin wa ala tahirin. As a preamble, let me just say that we are dealing with a very extraordinary situation. Similar events we just have been reading in history, it happened. We never dreamt or thought that we will see that in our own lifetime. And so these are very extraordinary situations, and that is where you have to realize that even the religious laws, the Sharia laws, about many things will change because of the emergency situation, where you have to take drastic measures, and many of the standard, expectations or obligations will be suspended or waived in order to deal with this problem of the virus, especially when it comes to how it's spreading. So let us always keep in mind that Islam deals with all different kinds of situations, including when it comes to such an issue where physical contact or even being close to one another or in a large crowd could have its own risks, and that's where Many things people say, how can you close the masjid, the mosque, and the Friday prayers? Well, we have to realize that protection of the life of a human being is the first priority in Islam. So everything else becomes secondary there. I'll just ask you, those who have not heard, I've made a presentation on Monday night here in Toronto. It's there on YouTube. You can listen to it and even follow the question and answers are there also. So anything here, let us hear, and then we'll see. We'll answer in the best manner possible, inshallah.
Thank you, Said. No. So one question that came up that was a little different than what we may have discussed in your earlier presentation this week didn't really center around burial. It centered around with this disease. And this is a matter, actually, the question resonated with me very well because I've personally experienced this twice with very, very close family members. When it comes to right now, the manner in which this disease attacks, I guess, the respiratory system, there may be requirements around life support and other mechanical means to keep sustain someone's life. What are some of the Islamic considerations regarding use of those devices? And as well, the question that was kind of tied to this, can a person refuse even though it would save their life?
Any medical device or treatment which is going to save a person's life, then it's mandatory to do that, and a person cannot deny that or refuse that. No.
And then with regards, the follow-up question on that as well was with regards to someone does go on a respirator or a device such as that, and the prognosis is not good for that individual in terms of sustaining their life, can it be removed?
That's where we have the dilemma between, what is the Sharia laws and medical science on this issue. That once you put a person on the respirator, you cannot really take it off, until, the person basically dies by himself or herself. Because if taking that off is going to stop the heartbeat, then that's where the problem would be. So that can be a challenging situation. God forbid, we don't get into a situation where even the number of patients will be much, much higher than the machines available. So I understand that, then the medical personnel will have to make a decision on who stays on it, who doesn't stay on it. We see some of these reports coming from Italy, which are very scary, and may, Allah subhanahu wa ta'ala protect us in this part of the world from reaching to that point. But, those will be then very exceptional and extraordinary situations, and probably we'll have to leave it to the medical experts to make the judgment call.
Okay. Then we had some questions here that came through through Menti. Let me just skim through one. So, Maulana, there were obviously the procedures that you covered regarding tayammum on a deceased body that has been affected with the virus, and they were very clear in the sense that it is not the normal process that we would go through. There is no obviously ghusl, kafan that we would normally have for the deceased. And just to share with everybody on the call, Nasimco, along with input from World Federation, Sayyid Muhammad Rizvi, and others that provided input, the guidelines were very clear in terms of the handling of that it would be very different. And there's a question here that came on Menti regarding performing tayammum, and is it okay to perform it wearing gloves? And I think Maulana, the procedure was that we would just do this outside. We wouldn't be opening up.
Okay, I think this is a good question, and there is actually an update to that. And I'm going to put this update also on the video, which was circulated on Monday night. My understanding was that if the medical health officials do not allow people to open the body bag, then the tayammum should be done over the bag. However, what we just came to know is that, according to Ayatollah Sistani, this is a very recent communication, that tayammum on the body bag is not valid because it becomes a barrier. And so let me just go through two steps which are important here to understand. If the health officials allow the family that, for example, you can open the body bag to do tayammum, then the tayammum can only be done on the deceased, on the forehead and the hands. However, the person doing the tayammum on the mayyit, on the deceased, can use the gloves. Gloves would not be considered to be a barrier in tayammum. But the option that I mentioned in the video on Monday night, that if the health officials do not allow you to open the body bag, then you can do the tayammum over the bag, is no more valid. So either you get the permission from the health official that you can do the tayammum on the body itself while wearing gloves, that would be fine. But the option of doing tayammum on the body bag is no more there. And if they are not allowing the body bag to be open, then the issue of ghusl or tayammum or hunut or kafan is waived, is suspended. We just do the namaz janaza and the burial, that's all.
Okay, thank you, Maulana. So just looking at these questions, there were some additional questions regarding burial, but more procedural towards what our process will be at Al-Ahad. And a lot of what we're doing, again, we are working on a communication. So there was a question regarding what are our plans. Our plans basically are that which was, again, provided by the Simple guideline, as well, members of our Maid Committee, Brother Ahmed, they've been talking obviously to the funeral home as well as the cemetery on procedures. So that document is currently being drafted, and we'll have a formal procedure that will come out. Obviously, with the updates that Maulana just mentioned right now around tayammum and how it's performed, I mean, it's pretty comprehensive. So we'll be sharing, a summary of what Nasimco published in terms of procedures that would impact, obviously, the deceased and the family, and as well the communications and feedback that we got from the cemetery. But I'm going to cover that towards the end of the call, in terms of when you can expect to see that bulletin. Okay. Just scanning here, I don't see any other questions for Maulana. Maulana, any other comments or advice for the community during this difficult time?
I would just maybe add one more point here, that in case the body bag cannot be opened, so the issue of ghusl or tayammum or hunut or kafan will be suspended. So the namaz is done, and then the question comes up, about turning the body towards in the direction of the qibla for the burial. That would be fine. You can just move this body slightly after the namaz is done, and then just bury the issue, and then the burial would be done normally. Talqeen, you don't have to open the coffin to do talqeen. In this case, you may just recite talqeen standing by the or sitting by the coffin. The issue of holding the shoulders of the mayyit would no more be applicable here. And also remember that talqeen is not wajib, it is recommended, so it can be even done after the burial has been done, after the body has been buried on the grave itself. Yeah.
Okay. Thank you, Maulana. The next item is a discussion with Mike Schlossberg. Oh, just before I go into that, if there are questions that come up, if you think of anything that we need to get questions on from Maulana, just please send those to us through the secretariat email, and we'll try to get those questions answered for you. So next we have Mike Schlossberg. Mike, again, thank you for joining us. I know it's Friday, and like I mentioned earlier, it's been probably a very, very hectic week with you with all that's going on. Can you provide us kind of a brief update kind of on where we are kind of at the state, maybe local level, and kind of where we can expect things to go?
Yeah, absolutely. And thank you all for the opportunity to speak. It has, you were correct, my friend. It's been a day, and it's been a week. And unfortunately, I fear those days are only going to get worse. In a nutshell, if you've been watching the news, you know that over the past, I'll say 9 or 10 days, the governor has slowly imposed more stringent, and I think appropriately stringent measures to try to stop the spread of this disease. We've certainly seen our cases grow significantly. They've grown by increasing percentages over the past few days. I believe statewide the number is now somewhere around the area of 250. Locally, there's 2 in Lehigh County, I think 10 in Northampton County, and 19 or so in Monroe. What I can definitely tell you is those numbers are significant undercounts as a result of some of the major problems with the federal government. There's been a real lack of testing. I know from a physician and healthcare perspective, there's a lot of fear of a lack of personal protective equipment. Spent a lot of my time working on that. Where we are at as a state right now is the governor has ordered a mandated shutdown of all non-life essential businesses. There's been a wide array of confusion. I understand why over what businesses can and cannot operate. Those businesses, starting tomorrow, law enforcement will step in and begin to enforce that order. Businesses can request a waiver. They can also email, they can also send an email to the governor's office. That's on my social media. To get an exemption for that if they fall into a category which is otherwise not deemed allowable. Now, there are not, as of yet, conditions or limitations on individual citizens' movement. You can continue to move freely. It's been asked, strongly recommended that you really limit the places that you go. I think that's safe. We are not in a lock-in situation yet, like states such as California, New York, and Illinois are either rapidly approaching or are. Across the nation, we're about in the middle in terms of where we are on a per capita basis, but I would again argue that that's reflective of a lack of testing more than anything else. We're not really any better or any worse in this state. I think the governor has been relatively aggressive, certainly, and appropriately aggressive, and we're going to need to do more. I know every now and then, and it seems to be sprouting up again. Last week, there were rumors we're going to get locked in and the National Guard's been mobilized, and that seems to have started again. I don't think there's any truth to those rumors. However, I would not be surprised if in the near future a lock-in order is made. Frankly, I sort of expect it, and I think it's necessary. There is no end date right now on any of these orders. It's not a situation that anybody wants. But in a nutshell, that's where we're at. I have about 5 or 10 minutes, and in that time, I'm more than happy to answer any questions about anything that I can.
Thank you, Mike. Sure. So there are a couple questions here. One is, what is Pennsylvania doing for current and future employment burdens? When is testing, and also when is testing going to be rolled out for anyone that needs it in PA?
Yeah, those are two great questions that I have a difficult time answering because they're more reliant on the federal government. Pennsylvania, like every other state in the nation, has a constitutional obligation to balance its budget. We cannot deficit spend, which means that we cannot provide anywhere close to near the relief that is necessary in order to make people whole or even approximately whole. That aid package will have to come from the federal government. The same applies to testing because the lack of supplies of equipment is going to have to be resolved by the federal government. The good news there is, it's a little bit of a double-edged sword in a sense. So the bad news is our positive numbers are going to increase really exponentially over the next couple of weeks. Some of that is unquestionably as a result of more positive cases spreading, but some of it is also the backlog of testing clearing and hospitals gaining more capacity to actually do the test. But again, we need federal assistance in order to get the supplies we need. What I will say, and I hope people understand, is we are significantly more lucky in this state than in the rest of the country. Pennsylvania has the 9th highest level of doctors per capita in the entire country. And we're in the Lehigh Valley, where we have 2 of the top 10 healthcare systems in terms of size and scope located in our backyards. And St. Luke's and Lehigh Valley Health Network have both really done I was joking about this. For those of you who are at all familiar with the healthcare system in the Valley, you know that it's like an ugly gang war between Lehigh Valley and St. Luke's. And they've been releasing joint statements and coordinating care left and right. And they've really done a fantastic job. They've started to open testing centers. There's at least, you can get it at their healthcare facilities, but I know they're also unrolling testing centers in Allentown and in Bethlehem. More will absolutely be coming online. But because we live in the Lehigh Valley and have St. Luke's and LVHN, we have access to testing that a lot of people would really kill for. And I think in the long run, we're going to be better equipped. I will say I know both of the hospitals are preparing for surge capacity. They're preparing for that when that moment comes, that unfortunately is likely that they have more patients than they have beds or equipment. And they're looking in that direction, and they started having conversations with necessary facilities in order to get where they need to go.
Okay. Another question here, Mike, is there a chance the governor will be requiring schools to remain closed the remainder of the year? And if that is the case, what will the impact be to the education of the children for this school year?
Yeah. Is there a chance that schools will close for the rest of the year? Absolutely, no question. I think, assuming that schools will open in 2 or I guess a week now, it's foolish. It won't happen. I just cannot imagine a circumstance under which schools will end up opening. In fact, we're going to be in session. It's going to be the strangest session week of my life because it'll be a virtual session. Members are not required to go to Harrisburg. And frankly, I've been encouraging all my colleagues to stay home. The CDC guidance is there shouldn't be people in a room of greater than 50, and there's no circumstance under which any of us should be exposing ourselves to more people than absolutely necessary. Part of what we're going to do is educational changes that will, formally suspend some requirements, waive some training requirements, and remove any penalties for schools that don't meet their 180-day requirement. The impact will be significant. There's just no way around it. There will be a major educational deficit. I will tell you, opening schools again this year is going to be extremely tough. There's just no way around it. For me, it's been a little bit of an interesting experience, and that it really, one of the things I talk about regularly is the divide between the richest and the poorest. My district, I represent about 20-25% of it is Parkland, in which internet access and access to appropriate computer equipment isn't even something most people blink about. And 75% of my district is Allentown, where 90% of the kids live in some degree of poverty. Parkland has the equipment they need to continue some sort of education. My kids in Allentown have the equipment they need. But the vast majority of my constituents really struggle for it, and it's something we are going to have to address. Unfortunately, pandemics only highlight the gap between the haves and the have-nots, and that's definitely something we're facing. And I will say that that's something we're going to need to pay attention to. from a public policy perspective, I hope folks understand this is going to reshape the decade, if not longer. This is a new 9/11. I have to put it that starkly, and it's unfortunately going to wreak more economic damage and take more lives.
So I think you might have addressed this question. This is a kind of a similar question. If schools do remain closed, will instruction be provided online? Seems like it's really based on the resources available, right?
Yeah, it depends on the school and it depends on the school district. I know that schools have been, and this is, you talk about an apocalyptic-like statement, but schools have been released of their formal education to teach from the Pennsylvania Department of Education. They are still providing some services, for example, and I mean every school has some degree of reduced or free lunch, and they're providing still in Allentown at some pretty large sites. But there's no requirement, and it depends on the district. And again, that's a lousy answer, but it's the only answer I have.
Sure, thank you. And then this is a interesting question here, Mike. I'm interested to see what your thoughts are on this. When are we going to see supply chain catch up with essential grocery shortages?
That is a good question. Every conversation, I've been on a couple of calls with the federal government and a couple on the state about this exact subject. It will be soon. Nobody could give an exact timeline, but having spoken with people at the governor's office and again, some conversations with the feds, the conversation has been very consistent. We do not have shortages. We have increased demand, but we have increased demand that can be met. The best thing we can tell everybody is it's almost a prisoner's dilemma, because if we could just get people to go back into their normal buying habits, nobody would have this problem because the supplies are there. But I don't know the answer about when the stores are going to catch up. I know they're trying hard, and I know, but I really will add this: as you go into grocery stores, as you buy your food and whatnot, please be extra nice to those folks. I can't tell you the horror stories that we've heard in my legislative office. I've had some of the most bizarre conversations I ever thought I would have. Just today, I'll tell you folks 2 funny stories if it'll make you laugh. I had to have a conversation with the Allentown Parking Authority today, telling them to stop giving people warnings that they were going to ticket people when they're not actually ticketing people, which I still can't figure that one out. And then I had to have a conversation with a contractor in a constituent saying, "Sir, please complete installing the toilet in my constituent's bathroom. It is necessary for life." This has been some of the most bizarre experiences I've ever had in my life, and those are only going to continue.
So again, Mike, really, really appreciate your time. This was very, very helpful. Addressing some of those concerns.
Oh, my pleasure. And I will, if you'll allow me 30 seconds, when this thing first started, many of you may know I'm a relatively religious Jew. My kids go to Jewish day school. I'm on the board of it over there. I'm very active with my temple, KI. When this started and we were having conversations about the religious implications of this, I told my kids a story that I remember from when I was a kid in Hebrew school about how it was Yom Kippur, the holiest of Jewish holidays, and there was a plague going through a rabbi's congregation, and many of his congregants were sick and dying. And on Yom Kippur, all Jews are supposed to fast. And instead of fasting that day, the rabbi got up in front of his congregation and he took out a piece of bread and he started eating it. And he said, "God wants us to keep our strength, and God wants us to live." And I am clearly not an expert, and I won't pretend to know anybody else's faith, but I will say that my view of religion has always been you do what you need to do to live and to survive and to protect your community. And I appreciate you folks keeping your members informed, and please let me know how I can contribute to that process.
Appreciate that much.
Hey, Mike.
Thank you.
Thank you. Wayne here. I just want to thank, again, Mike, you for your time. We really, really appreciate it. I know the community.
My job.
And, well, we appreciate you taking your time, and we really do. We know it's your job, but we appreciate you and everything you do. And I just want to say for people who are listening, remember to support Mike, please. He's always been there for our community, and he's doing everything he can to assist everyone at this time in PA, his constituents, and also Peter Schweier and Susan Wild and other individuals, our lawmakers, are working hard for us. Take the time to to remember them, thank them, and again, Mike, thanks again.
My pleasure, guys. Take care, folks.
Thanks, Mike. Okay. So a lot of the questions, and I know we had, you guys not have spoken to Dr. Hashim yet, but Dr. Hashim was very instrumental in obviously guiding us a few weeks ago when we had to make the decision, the very difficult decision, whether to keep the mosque open or close it, and was very convincing in terms of the dangers that this virus poses. So again, it's always good to get information from someone who's really on the front line, who's battling this issue day in and day out, and truly understands the risks that are associated with this particular virus. So, Dr. Hashim, are you on the call?
Yeah, I'm here. Can you hear me?
Yeah, we can hear you. Again, thank you so much. I know you are working and are on call right now, and I know it took some precious moments out of your schedule to address some of the concerns of our community. So thank you again very much.
You're welcome.
So since we last spoke, Dr. Hashim, a lot has changed. I think the last time we spoke, we didn't have any cases here, and just yesterday, I believe, was the first death right here in our backyard that took place due to the virus, and the number of cases has exponentially grown in just a matter of 2 weeks. So any updates that we should be aware of in terms of how the virus is spreading and precautions that we need to be taking above and beyond what the officials at the government level have taken, as well we have done here at the Jamaat level in terms of social distancing?
Yeah, just if you can just update me on exactly what you're doing at the Jamaat. I understand you're closed to the public, but are you still having small gatherings or not at all?
So the mosque is officially closed. The only thing we are doing is just us members that are on the management, and I'd say it's a really skeleton crew of about 5 people that go there to just ensure that we're able to execute programs. And then we do have some folks obviously doing video conferencing. But just with the tools that we have, there is a necessity to be at the center to be able to execute. And again, it's a very, very small skeleton crew that's doing that.
Yeah, I think many centers are doing that as well. I think even in New Jersey, where I'm at Masjid Ali and MFI, they're doing something similar. The only thing I would still be concerned about are those 5 people that are getting together at the masjid or at the center are staying as far apart from each other as possible. And when we spoke last a couple of weeks ago, a few weeks ago, whatever it was, I kept harping on the point that this is gonna get worse, and I don't think we're anywhere near the crest of the wave, if you will. We're still going up that wave, and what I would tell you is, so what we know so far about the virus is that in terms of infectivity, so how it can spread from person to person, it seems to be more infectious, or it can spread more than how the flu is spreading. So one person can infect about 3 people, whereas with influenza, the numbers that I saw was 1 person to 1.5. So that is alarming to me. And I would tell you that even with those few people that are coming to the center, they really need to be careful how they interact with each other and what they're touching and who's touching it after them, who touched it before them. Those kinds of things seem small and perhaps mundane or simple, but they can make a huge, huge difference in how the disease is spreading. We also know that people who are asymptomatic, or those without any symptoms, can spread the disease while they're without symptoms. So you're having these few people, 5 or whatever number is, getting together, if one of them had been around someone who was sick, or they didn't even know they had it, they can still spread it that way. So it's not without risk to even do what you're doing, but at some point, I guess you have to decide, and you try and mitigate those risks as best you can. So that would be the only other thing I would add to that in terms of what you're doing now with your programming. And again, you're not alone in this. Many centers are doing this. They're doing the feed, the live feed, and remote access and those kinds of things. But all I can say is just be careful, because it's not eliminating the problem altogether.
Sure. Thank you. So there are a few questions here. Actually, the lion's share of the questions that came in were all virus related. So I will just go through them here one at a time. So the one that came through here was actually one of the many that came through was, how does the COVID-19 virus affect 1 and 2 year olds? Is it the same as adults?
Yeah, so what we're seeing, again, I'm not in pediatrics, but the data that I know about is what I've been reading about in the literature as well, is that those, I guess, kids, that we'll call them kids, less than, let's say, 10 years old or so, 9 years old or less, they seem to be handling it well, and the young ones as well. Now, if you're talking about infants, I don't have that information in terms of what it is in the U.S. Everything that we know is from overseas. But in the same vein, I would tell you that the question about, I don't know if this is leading to that question about school closures, but the main reason why the schools would need to be closed, even though the children aren't the ones that are quote unquote getting sick, is because they can be carriers. And that goes back to the point that I made about asymptomatic carriers shedding the virus and potentially exposing others. Not potentially, they are exposing others. And many of the people in our community, they live with their grandparents. The children are living with the grandparents. There's the family unit is not a mom, dad, and kids. It's grandparents as well, and extended family in many cases. So you have to keep that in consideration when, even if the children aren't getting sick, or they may have a mild illness, it's who they're around that really worries me. The parents, grandparents, aunts, uncles. And you saw today, I think, in New York at least, the governor made the announcement that, you should avoid visiting family. I think that, is very important, because you may not have symptoms, but you're still shedding the virus. So in terms of how the kids are handling it, it seems that they're not getting as sick as the adults are, but they can still be carriers.
I think you might have just alluded to that towards the tail end of your answer to that question, but there's a question here is then, what is your advice to those who are still holding family gatherings from multiple households and kids playing together?
Don't do it.
Okay.
It's as simple as that. You're putting everybody at risk. Sometimes you got to be blunt. You can't do this kind of stuff. It's dangerous, and you're putting people at risk. And we spoke about this when we were talking about closing down the masjid, the centers, and this communal kind of behavior that we have in our culture. It's great, but in times like this, you have to be smart, and you have to understand the way the virus is working and what the science is. This thing is contagious. This virus is contagious, and little kids can be carriers, and you're putting them with other little kids who are going to be around adults and elderly. You you shouldn't be doing that, would be my advice.
Okay. Couple. Just trying to pick a few good ones here that others have liked. So, for those who have thyroid conditions such as hypo, or hyperthyroid, does that make them more susceptible to a virus like this, or have more complications?
As far as thyroid conditions, we don't have data. At least I don't have the data. What I have seen is people who are diabetic, obese, meaning overweight and obese, they seem to be getting sicker than the ones that don't. Now that's, anecdotal data based on what I've been seeing, but in terms of actual thyroid conditions, I don't know if that in itself is a risk factor. But if you think about it in general terms, right? Those who are diabetic, they don't have the same kind of immune system that non-diabetics have. So the general theme is that those who have underlying immune conditions, autoimmune disease, or immune conditions that they are considered by their own doctors that their immune system is not normal, then I would say those people are at risk, more at risk. So now, in terms of the thyroid itself, that I do not know.
Okay, good advice. This is a good question because I personally have to address some of this myself here. What about sharing food with neighbors, and can food be contaminated, even takeout food, since that's allowed by the state?
Yeah, that's a very good question. We've looked into this, and I think there was some stuff out from the CDC about this. As far as I know, there is no, at least no obvious or known risk with eating food from restaurants and such. But when it comes to the utensils, if you're sharing utensils with other people, I would be very careful and make sure those are clean. I don't know myself of any transmission based on food ingestion, but we do know that secretions can be shed by either saliva, coughing, and those kinds of things that come out of the mouth and can be inhaled, and that way can be transmitted into the lungs where we're seeing the problems. Now, in terms of actual, it sounds a little gross, but eating those things, swallowing those things, I don't know if that, the last time I checked it wasn't, and that was a couple of weeks ago, and they haven't stopped the restaurants from serving food, so you're hoping that everything is done in a clean way. And so far I haven't seen any transmission just from my own practice, from the people that I've been taking care of so far. I haven't gotten any kind of indications that they acquired it from food.
Okay. And this may be kind of linked to it a little bit. So this is about visiting grocery stores and then coming home with the groceries, the bags, etc. And as well, I think there's a question here about visiting gas stations, holding the handle. Is that a mechanism? Is any concerns there with the overall shopping experience?
Well, you know what? Fill your gas in Jersey. You don't have to pump it. But if you are doing this on your own, it wouldn't be a bad idea. Again, this is, the same thing has always been there, right? You can still get, germs from door handles, gas handles, pumps, all those things. So what I do when I go to the places where I have to pump my own gas, I sometimes take gloves, and I do it that way. I try to have as minimal contact with my hands as possible. Now, you can do all of that, but if you end up using a hand sanitizer or washing your hands, that's just as good. And that's in terms of pumping the gas. If you after you pump your gas and you get some hand sanitizer and you clean your hands, that would be a good idea. In terms of the grocery stores, so I went grocery shopping yesterday, and I went to it was a ShopRite or something like that, and they have Purell wipes right when you walk in and hand sanitizer right when you walk in. So you wipe down the baskets or the carts, whatever you're using, and use the hand sanitizer. I saw people walking down the aisles with gloves on, but I don't understand the logic there completely, because they're wearing those gloves, they're touching the carts, and then they're touching what they're buying, and they're putting that into their baskets or carts, and they're eventually taking that home, but they've touched it with the glove that was in contact with everything else. That kind of defeats the purpose. So you have to be a little smart about what you're doing. If you're going to wear the gloves, then you got to clean everything after you've done that. So I would tell you, cleaning your hands is going to be the most important thing. And we talked a little bit about that on the call last time, with you and with the administration, that hand hygiene is going to be the biggest thing in terms of barrier to spreading the virus and then eventually the disease, because you're using your hands to touch all the time, whether knowingly or unknowingly. So you've grabbed that stuff off the the whatever it is in the aisle that you're shopping. You take it off the rack and you put it into your cart, and you're wearing a glove. Okay, fine, but that glove was dirty already. So what was the point of that? And in terms of plastic bags, yeah, we know from the literature that the virus tends to stick onto plastic longer than other kinds of surfaces. But what I would do, if you could, try and maybe bring in your groceries not through the main part of the house. If you can go through the garage, for example, and take out the stuff out of the bags, and try not to drag the bags all over the place. They're trying to get rid of plastic anyway. If you can use bags that perhaps are cloth that you can wash and recycle and reuse, thereby by washing them, we know that by using the laundry and washing the clothes and the dryer, that the virus does get killed. So maybe that's another option rather than plastic bags. But some of this, you got to live too, right? I mean, you can't be a hermit for the rest of your life until the virus goes away. You have to try and adapt, and perhaps wearing gloves when you pump gas and then throwing the glove away right after you're done, not getting back in the car with the glove, and using hand sanitizer is one way to adapt. Perhaps using cloth bags that are reusable and washable after you go shopping is another option, in a way to adapt to the reality that we're in right now, which I have to say I think will go on for some time, just like the congressperson just said.
Does the human body remain infectious after death, and if so, for how long?
I have no idea on that one. We have no idea how long the virus will stay on the body, and I think that goes back into the whole religious discussion about, the kafan and the ghusl and those kinds of things. That's a very, very challenging situation that I don't know if there's a perfect answer to. In terms of how infectious or how the body is, we don't know. We know that the secretions can stay, and they drop, and they can be in the surroundings for a few days at least. and whether or not they're settling on the clothing of the deceased person. That's certainly a possibility. But then, if they're taking the clothes off, is there any on the skin or not? It's hard to know. I don't know if anybody's actually looked at that. And how long? How would you know how long it stays on a dead body? I mean, you'd have to leave the dead body there for God knows how long until it goes away. I don't think anybody's really going to check that.
So these precautions then are wise in terms of what we're being advised to do.
Which are what exactly? Because I still think there's some confusion on the burial process. I'm not completely sure what the right answer is. What is the final recommendation? Are we doing only tayammum on these patients, on these people that pass away, or is the ghusl okay? Or
so no, the ghusl is not okay according to the scholars. It is tayammum, and then it's not even opening the bag to perform the tayammum. It's over the bag, is what the guideline has stated.
Okay, I thought Sayyid Rizvi said that you can't do it over the bag.
Yeah, so that was something new. So I haven't. Again, I guess he's an update, and I guess we'll review. I didn't capture all his comments entirely.
I guess the point is that this is still a dynamic issue, and I'm not sure we're at the final kind of recommendation yet. I have my own thoughts on that, but I'll keep those to myself. We at least at Masjid Ali and MFI, I know they were still discussing how to go about the burial and the logistics, because you also, if you're doing the burial at, for example, a mosque, and you're going through the ghusl, or even just the kafan and the whole process of having a mayat in the mosque, how does that affect the local health department in terms of, do they have to come in and inspect the place to make sure it's clean? I don't know if you've gotten any guidance on that from the local health department on having a body there that may be going through that process. Do they require some kind of inspection or not?
Yeah, so that's some of the items we're addressing through our procedure. Again, I don't want to state anything right now because we haven't, like I said, it's still in draft, and we're still having discussions, obviously, with the funeral home and people locally in terms of guiding us on what the right procedure would be. Do we bring the body back to the mosque? Are we equipped in terms of the process of disinfecting? I know funeral centers have specific procedures in order to do that in these matters with infectious disease. Those are all things that obviously will be addressed in the bulletin that we're going to put out to the community once we get those items those questions answered.
Yeah, it's not easy. I don't envy you in terms of having to do this, because this is it's still a moving kind of topic.
Yeah.
We don't know what the final right answer is. So.
And that's the issue. We got a guidance yesterday, and then already again today. There's it's been changing daily. So, and again, we've not experienced anything like this in our lifetimes. So,
No, but you know what? I don't know if there is a parallel or not. But when you have a mayat, for example, and they may have dealt with this more in the 90s and late 80s, but with HIV and AIDS. What would have been the process then? They may be able to draw some parallels to that, or anything. I don't know if when we had the Ebola crisis, a few years ago, well, 5 years ago, I think now. Were there any recommendations that were given at that time? Do we have anything like that? That would be something, I guess, from a medical perspective, I would at least look at in terms of a reference point to go by. Stuff that was going on in the late 80s and 90s with the AIDS. Many of those had communicable diseases that had died. Those patients, those those people that died at that time, and also when we had the Ebola crisis, 5 years ago, I believe it was 2015. What was the guidance then? Those could be reference points in terms of where to go from here.
Good advice. And then I'm going to combine these next two questions because they're kind of similar. So I guess this is more of an opinion question. When do you or can we expect to see the infection curve going back down? And realistically, what therapies and vaccines, when can we expect them to be released? Clinical trials, are there any, legitimate trials in progress? And there's been talk about these malaria drugs, such as chloroproquine or chloroproquine.
Yeah, chloroquine.
Can they slow the virus down?
Yeah, so in terms of the chloroquine, we don't have chloroquine here. We have a version of it, if you will, a variant of it called hydroxychloroquine, which is known as Plaquenil, which is used by many people who have lupus and similar diseases. I am using that now on patients. We are seeing so far mixed results. And there was a study that came out of France recently that showed about a very, very small sample size. I think it was about 20 patients that got this drug and who, not as prophylaxis, not as preventative, but as a treatment. They had COVID-19, they were very sick, and they got the drug, and there was some positive results, and then they added it with the second drug, and they got even better results. But that is something I know that is being looked at. We've been using it. I think the media is getting word of it now, but I started using Plaquenil on my patients who I suspected had COVID-19. We started, I believe, I want to say late last week, early this week, and it seems to be catching on more and more. It's a promising, I'm hoping a promising treatment. We don't know. It may not be. What we thought last week, we know now is not. For example, some of the old HIV medication that we used to use was thought to have some benefit, and a lot of these patients were on it, and a lot of these COVID-19 patients were on it, and it turns out they did the study and it's not helpful. And that was, that all that stuff is coming out now in terms of all the literature and the studies and such. So the chloroquine, Plaquenil, that so far looks like could be, at least for time being, a possible treatment or part of the treatment, but I think they need to study that more. We're doing it because we're seeing some data that it can help, but again, we have to wait and see how these patients end up doing because it's still too early for us to know. In terms of vaccines, they started the trial. I believe the CDC has already enrolled at least, I think, one person that got the vaccine. I think we're probably about a year at least a year away from a vaccine. And there are trials now. There are a lot of trials. There are also trials that will go on for prophylaxis, meaning preventative, looking at chloroquine to see if that can help prevent someone from getting COVID-19. And all those things are still, just starting. So we're I think at least a year away from a vaccine, and maybe who knows how long from treatment. And in terms of, I guess the question was, how long will this go on for? I kind of alluded to it in the beginning that I think we're not close to the crest of the wave. We haven't gotten to the top yet of that curve, and part of the problem, and it's a huge part, is that we don't have the ability to test everybody yet. Let alone, forget the people that have no symptoms, which would give us an idea of what the general prevalence of this of the virus is in society. We can't do that, but we can't even check everyone that's sick. And those that we are checking, we're waiting. In the hospital, I have when we talk about PUIs, the patients under investigation, people who we suspect might have it, but we don't have test results. I've got over a dozen in one hospital. I've got several in another hospital that I'm covering, and we're just waiting for the results to come back. So we don't know when we'll get to the top part because we still don't know how much is out there. That's the simplest way of putting it. We don't know when we're going to get to the top of the curve because we don't know what's around us right now, and we need that. We need that information to gauge how we're doing. We really need those tests. That's the only way to know. But if I had to guess, my opinion, we're not at the top or near the top of the curve yet. We're probably, this is just somewhat of a arbitrary number. I guess maybe 4 to 6 weeks, I guess, if I had to, but I have no idea because it's like shooting in the dark. Until you have the ability to test everyone, there's no way to know.
Okay. Dr. Ash, I know you're limited on time as well, so I'm going to try to lump these next 3 questions together because I think they are related. It basically has to deal with the virus, whether or not it's airborne or not. Assuming that it's not airborne, one question is, if that's the case, then how would the virus spread from a dead person, a deceased person, if the body bag is open, an example, to perform the yamam? And then does the hospital disinfect the body before turning it over to the funeral director and our Mayth committee?
To the last part, I don't know what the hospital does with the dead body. That I don't get involved with. In terms of aerosolization, what you refer to as airborne, so there are two things on how these respiratory diseases are spread. One is a droplet. The other one is aerosolized airborne, such as tuberculosis is one, measles is another, and droplet is like influenza, the flu. So in the hospital, there are 2 kinds of precautions that we take. When we talk about, you've heard the term PPE, personal protective equipment. Part of our PPE is the mask that we wear before we go into a room and the kind of room that it is. So for airborne precautions, you have a negative pressure room, which is sucking the air out of the room, filtering it through the hospital's filter system, and then circulating the air back. So nothing is pushed out of the room. If you ever open like a solid metal door or like a big fridge door, you can feel the gush of air that comes out. In a negative pressure room, that air, instead of coming out when you open the door, is sucked back in so as to not let particles out. So that we do for example, tuberculosis patients who have TB. Now, the other, for example, influenza, we don't do that. We use droplet precautions, which is The room door is a regular room. The door is closed, and we wear a surgical mask when we go inside. And the thought behind it is that, and for example, for the airborne room, we use you've heard of the N95 respirator mask. We use one of those which is a little more, I guess, protective than the surgical mask. So for COVID-19, it seems like, from what I've seen and what we're doing now in the hospital, that it's more of a droplet situation rather than quote unquote airborne, where the particles will float in the air for a while. These are slightly heavier. They do settle down on surfaces, and so when we go into the rooms, we're not using N95s unless the patient is on a ventilator or they're going to have any kind of procedures done where things will be aerosolized. For example, if they're going to be on certain kinds of breathing machines or they're getting certain kind of respiratory treatments, those will be considered where the particles can fly, if you will, a little longer than if they weren't getting those treatments. So it's more of a droplet situation rather than airborne. And in terms of the body and the burial thing, so it's not so much whether or not it's airborne or droplet, and that's why they're doing that. It's about the particles and about the virus settling down, like landing on surfaces. So the body, in theory, can have these particles. Had the person been coughing before they passed away, those particles may have landed on them. That's the concern. So that's why this is a big issue about the burial and about the ghusl, because we're trying to figure out the safety of the people that are going to be performing the ghusl and preparing the body for burial, in terms of the virus being able to be transmitted if they're physically touching and handling the body. Because if it is droplet, then yeah, you can. And even if it's airborne, then yeah, in theory, it can still be there in both cases. So it's not so much that one versus the other is better if the body, the person is deceased. I think they're both risky, and they both, whether it's airborne or droplet, they're both risky when you're dealing with a dead body, and they have to take very special care, and they have to wear the PPE when they're handling the body, even if it's a deceased person. So it doesn't matter, airborne or droplet, makes no difference to me in terms of how you handle the body.
Okay. And then the last question, I know we're getting close to the end of this. We have to wrap up here by 7:30. And this hopefully is a simple question compared to the other ones. Does a sore throat warrant an examination for the virus?
On its own, I would say no, not a sore throat. But if you have a fever with that sore throat, I would be more concerned about the COVID. Now, remember, common things are still common, right? It's still people still coming in with flu and other respiratory viruses. So, what we're seeing is that people that are coming to the emergency room will be checked for the flu, and then if it's negative, they'll be sent home and told to self-quarantine. And not everybody is getting tested for COVID-19, at least not in New Jersey. I don't know what they're doing at Lehigh or St. Luke's over there, but in New Jersey, we're not testing everybody for COVID-19. We just don't have enough tests. So the people that are coming in with typical symptoms, sore throat, fever, cough, dry cough, those are the ones that we'd be more concerned about. They may warrant testing for COVID-19, but we are seeing that people are still coming in with influenza and other respiratory viruses. So we're not out of that window yet for that. So on its own, sore throat, that wouldn't raise a red flag for me. But if you had a dry cough and a sore throat, add to that a fever, then that would be more concerning. And certainly if you've been exposed to someone who had COVID-19, that would be a giveaway to me.
Dr. Hashim, again, really, really appreciate your time. I know you're very, very busy. If there's anything that we can coordinate to help you out, while you're spending countless hours, I'm sure, at the hospital treating patients, let Shane or I know. We'll coordinate. We have a lot of, within our network. We'll get you whatever you need, in terms, I know you got to focus on what you have to focus on. And then also we pray that God keeps you safe. I know you're dealing a lot with folks that are infected. Hope through this that you're kept safe and free from this virus.
Well, thank you. I appreciate that, and just keep me in your prayers for safety and for all of us, and especially the seniors in our community. My parents live there. I worry about them as well as everybody else. Please, everybody, be careful, be smart, try and avoid. I know they said 50 people. I would say even 10 people. If you can, take my advice. Try and stay home more, and avoid large gatherings. And this thing is real. It's contagious, but we have the power to stop it if we are smart about it. So I would advise you to do that. Please remember me in your du'as. Keep me safe, because I have my own family here that I'm coming home to every day, and obviously that's on my mind. But inshallah, everything is in Allah's hands. So we pray for everybody and for the safety and prosperity of our community, inshallah.
Inshallah. Again, thank you so much. All right.
Thanks.
So we're going to wrap up very quickly here in the next 5-10 minutes. If there's any questions for the MC, send those through. I think there are one or two that are in Menti now. But just want to, again, let everybody know the decision, obviously, at this point is out of our hands, whether or not to keep the mosque open or not. At this point, right now, we're expecting to stay closed until April 5th. That does not mean we're opening the 6th. It just means at this point, the situation is very fluid. If you remember a few weeks ago on a Wednesday night, I gave a update on the matter. And at that time, I said, we're not closing. Only 2 days later, we closed. So this thing is very fluid. It's changing. As Dr. Hashim mentioned, I don't think we reached the peak of this yet. So, the target is moving. And even, with some other matters which I'll address, there's some moving targets, which is hard to get some final answers, but we're going to get them very quickly. And I'll let you know what we've done around barrier and other things. So at this point, we are monitoring the situation daily. I'm on countless conference calls, chat groups with Nasimco, Wealth Federation now as a task force. We have connections with various doctors and specialists and government officials that we are connecting with as well. Here locally, as you know, I do counsel with many individuals in terms of what we're doing. Just so you know, we're doing a lot with the trustees and the other subcommittees. We're having sessions now. I think we're going to have a weekly cadence on status on where things are at and where things are going. So these are the leads of all the leaders within the subcommittees, Madrasa, Mayat, Ladies Committee, and so on are well aware of what's happening. And, we're going to share information as it becomes available, at least weekly for now. We, again, can change that cadence if we see the matter required. In addition, if this town hall session was helpful, it's the first one we did. So again, I couldn't have everybody on the phone at the same time. We didn't have a mechanism to manage that, so we used Menti. If you feel this is helpful to ease some of your concerns, please share the feedback, and we can coordinate another session in the near future or as needed. So with that said, the mosque right now, again, like I said, will remain closed until April 5th. We'll reevaluate. I know I'm getting a lot of questions about Maha Ramadan. I have no answers for you at this point. Like I said, this is very fluid. It's a moving target. We'll assess it. I mean, inshallah, everything is better, that we're able to resume programming, by the end of April, and do our du'as and amals together for Mahi Ramadan. But again, no official word on that yet. Madrasa, as most of the parents know, is fully virtual. As of last week, was the week I think they made it optional. Alhamdulillah, great response from the parents and the children. We had about 80, just shy of 85% participation, and that's pretty good considering that it was optional. But this week, inshallah, that went very well. The virtual classes, again, kudos to the Madrasa subcommittee, Brother Munawar, Sister Zaida, and Sadiqa Bai. Great job, the whole administration making that all happen. And this week, for the parents, again, at this point, the classes, again, attendance will be taken. And obviously the assignments and things, they have their process that they've communicated in terms of grading and so on. So any issues there, again, if you are having hardships due to the virus, and that impacts participation, again, let the key people know. Again, all these matters are handled in confidence. You can contact me directly. I left my number in the email, or you can contact a member of the Madrasa subcommittee. As well, all our programs now are fully virtual. We've had some commitments, obviously, to the speakers, and we maintain those commitments. I do ask, I know it's hard right now, we're not seeing individuals and interacting in person, which is, how we usually generate the funds to make these programs happen. So I will send out a note. I am requesting all community members now to please donate generously. If you haven't paid your lawajim, please get those payments in. This doesn't change our responsibilities in terms of making sure that the bills are paid, and as well the scholars, the ulama that we're bringing in to carry out the programs, are also compensated for their time. They too, just like many of us who are impacted by this virus and our employment, they're impacted heavily. This is their busy season, and I want to make sure that we're honoring our commitments to our scholars. We will be sending out an updated communication in the next day on where we're at. So a lot of the things I just mentioned will be reiterated or addressed again in that communication. I'm not sure. Most families probably didn't make it to today's session, but we want to make sure the community is well informed, and we'll continue to do that. And the key message, and please reiterate this, and I know one sister came to me to alert me of a matter where there was a family that was really not struggling from a financial sense, but just more from a panic sense, brought it to my attention. We were able to talk to them and really, help them with this is really causing a lot of anxiety in families. And the message I want everyone to understand, right? And this is my word to you. This is the MC. I'm speaking for all of us. We're not alone in this, brothers and sisters. We are together, no matter what happens throughout this whole crisis or pandemic, whatever you want to call it. We're together. We are one. Understood? So if there's anything that this has any impact on you, be it anxiety, I know sometimes we're sitting at home, there's that loneliness, whatever it is, we're working on things right now. I'm really proud of our community. Many people have come forward with ideas on how we can engage our seniors, for example, our youth, and you'll see some of these things over the course of the next few days. We'll be announcing these programs. But again, proud of those who come forward. A lot of, I know there's some volunteers that have put notices out. If you're sick, you need help getting groceries. If you're elder and want to avoid the markets, again, you don't have to go out. We're all, again, a family. And I want us to rely on each other to make sure our needs are taken care of. So again, no one's alone in this. All right, we're together thick and thin, through thick and thin till the end. All right. The other thing I want to make sure that we all understand is sometimes, and it was interesting a few weeks ago, a young lady was texting me in the community. There was a event that they had qualified for, and that event canceled. It was the World Federation Youth Retreat, and I made a comment that, even though these calamities happen, there's a purpose behind them. Allah is very deliberate in terms of what He sends us in terms of tests, right? And right now is an opportunity. It's a time to change, right? It's really time to reflect, both spiritual and non-spiritual, right? Each of us, I know there's a lot of comments. If you were on the meeting with Sayyid Rizvi this past Monday, a lot of comments were coming. Is this the end of times? Is this the sign that the Imam is coming? Is this a punishment on mankind? Irrespective of whether that is true or not, we don't know. But we need to reflect on what's happening around us, right? Each of us can come out of this, and if we don't, shame on us, because we all wish the world would stop, give us a chance to catch up. Well, it just did. Maybe not in the manner that we would have liked through an illness like this, but right now, many of us now have time. We're not maybe doing our daily commute back and forth to work. It gives us time to spend more with our family, right? It may be time, maybe for some of us, I know some have been impacted with their jobs, with the closures, not having work. Maybe it's time to reflect. And I said this a few weeks ago. We're at the dawn of the greatest industrial revolution that's about to come. There's things changing in society today in terms of skill sets. This is a good time to take training. If you need counsel or advice on where to get that, there's a lot of free training out there. Contact me. I'm happy to give you that guidance. A lot of it, again, is going technical based. You don't have to have a degree. You can learn these things on your own, and there's going to be new opportunities that'll be opening up for you if you're looking for that change. Spiritually, I look at myself in the mirror. There are many things. If this is true, this is all punishment, or this is a sign of the Imam, brothers and sisters, we have to wake up. But we got to look at ourselves. Can't wake up the neighbor. I can't wake you up. I got to look at me first. I have to see what my flaws are and what we need to fix. And I think all of us have that opportunity right now to do that. And that kind of leads me to one thing that I know Sayyid Rizvi dropped off the call, but just in the last day or two, he did a communication. He actually did a short video, about 6 minutes. And he talked about the virus of misinformation, right? Fake news, backbiting, just flat out lies, right? A lot of it that in his talk was related to the disease and the misinformation we're using or miscommunicating through social media. But this existed before this virus, right? It's interesting that for a virus, we have now shut down our mosque that's destroying or has a potential to kill us, right, in this dunya. But this disease of misinformation, this virus, has been going on for as long as mankind knows. And it's very prevalent in our community here, right? We should have closed our mosque down for this. This is a true cancer. This divides communities, right? But we haven't, and we can't shut down for this. But what we can do is shut our ears to, because that's still going on today, right? We need to be very cognizant that if we didn't hear it from a source, or we don't verify the source, we can't take things for fact, right? And that misinformation, like I said, destroys communities, right? And my last message, and I know this is not related, or this is not really directed here at this community. I know there's some individuals that are from other communities that are plugging into this this call, right? Let's just take a look at what's going on, brothers and sisters. Again, I mentioned earlier, we're one family, right? Right now, what we're going through, the only people that have our backs is each other. That's all we have, all right? We have a lot of divisions in our community, particularly, I'm not going to mention communities. They exist in the north, we know they exist in the south, west, and east, right? Find a way to unite, right? To those who have the powers to invite your communities again, right? Reach out to the ones who walked away. Take that first step. Invite your brothers and sisters back. And those of us in this community who know of those communities or have ties in those communities, we have to be ambassadors of that message, right? If we're expecting our Imam to come back, we can't be divided like this, right? So let's find a way. Let's stick together. We'll get through this, I promise you, right? With every calamity, afterwards, you see massive change, massive growth. And we have that opportunity for ourselves as well as for our community. Again, at any time, if any of you need anything, please reach out to myself, reach out to a member of the management committee. Again, we have you. We're here to take care of everyone, take care of each other, And again, follow the guidelines and be safe. So with that, we'll close the meeting. Again, thank you. If you feel that this was helpful, and maybe another week or so have another one as things change and progress, please share that feedback. We're happy to schedule another session. With that, brothers and sisters, Assalamu alaikum.